one of the most complex yet common skin disorder. It runs in families. If both the parents are affected, kids may have 60% chance of developing psoriasis in their life. Actually, psoriasis में होता क्या है? Psoriasis doesn't only affect the skin, but in 10 to 20% of the patients, it may affect the joints as well, and that condition is known as psoriatic arthritis. If we'll talk about the causes of psoriasis, they may be hereditary and low immunity are the most common ones. Stress and distressing life events, they play an important role in triggering up or flaring up the condition. There might be skin injuries which can lead to psoriatic conditions, recurrent throat infection with streptococcal bacteria, and that might have a great role in production of psoriatic patches. Symptoms can be localized on the skin or they may be widespread as well. Most common skin symptoms are itching of the skin with thick silvery scales. Scalp psoriasis may be misdiagnosed sometimes as dandruff only, but we need to diagnose the conditions very carefully. Any kind of physical and mental stress aggravates this condition. Living with psoriasis can lead to many emotional and social consequences. एक पेशेंट जिसकी स्किन पे इतनी सारी प्रॉब्लम्स हैं, वो कहीं भी आने जाने में उसको हेजिटेशन फील होती है, इमोशनली एक इन्फीरियरिटी कॉम्प्लेक्स आना शुरू हो जाता है, जहाँ जहाँ वो जा रहे हैं वहाँ वहाँ उसके फ्लेक्स उतर के गिर रहे हैं. दैट इज़ इन सच एन एम्बैरेसिंग कंडीशन फॉर अ पेशेंट. होम्योपैथी में सोरियासिस का बहुत ही अच्छा ट्रीटमेंट है, बिकॉज फर्स्ट ऑफ ऑल होम्योपैथी टेक्स इनटू कंसिडरेशन द मेंटल सिम्टम्स. सो हमने जैसे देखा कि सोरियासिस के कॉजेज भी स्ट्रेस से रिलेटेड हैं, एंड इससे पेशेंट को बहुत सारा इमोशनल डिस्टर्बेंस हो जाता है. सो व्हेन अ पेशेंट कम्स फॉर होम्योपैथिक ट्रीटमेंट फॉर सोरियासिस, we take into consideration all of the aspects: how it started, when it started, what are the life events which were coincidental with that condition. For example, a patient was perfectly fine 10 years back, but suddenly death of a mother, death of a father, or death of any loved one created some of the emotional disturbances in the life of a patient, and that triggered or that flared up the condition of psoriasis. Homeopathy helps in treating the scaliness of the skin. Homeopathy helps in treating the itching of the skin. Along with this, after taking homeopathic treatment, patient is feeling well mentally as well. क्योंकि अगर दिमाग से इंसान शांत रहेगा तो स्किन की कंडीशंस ऑटोमेटिकली डिसअपियर होनी शुरू हो जाएंगी. इन होम्योपैथी वी लुक इनटू द इमोशनल कॉजेज ऑफ सोरियासिस. So if we treat on the basis of emotional causes, the disease is being treated very finely. Homeopathy also helps in reducing the pain related to joints when there is psoriatic arthritis. So I would suggest to the persons living with psoriasis, they should take homeopathic treatment for this, because it not only acts superficially but also acts deeply. They should not apply topical ointments for psoriasis because they will only suppress the disease condition, but homeopathy will treat the disease from its roots.